Good day, dear students. In current lecture, we'll talk about herpes virus. It is unique family Herpes viridae of double-stranded DNA containing viruses. And name for that family was given because one unique option that or property, sorry, of the virus, that virus can cause infection in one tissue, but after that it will establish lifelong latency in another tissue. And actually, alpha herpes viridae, the very first virus is described in the gene family. They can cause infection in epithelium, but after that they will crawl by the way of sensitive nerve into the ganglion and establish latency here. During exacerbation, they will crawl back by the nerve to the area of the skin innervated by the nerve and cause again an infection. So any episode of infection by herpes virus will establish a lifelong persistence of that virus in human body. And actually, till nowadays, we don't have any option to cure completely infection. We can only control episodes of exacerbations or recurrence. So usually, first episode of disease caused by herpes virus is slightly different than further exacerbations, and about 100 different viruses in herpes viridae are described, but they can cause infections not only in human and animals as well, and viruses are enveloped, and of course, common structure is applied. They have glycoprotein spikes, genetic material surrounded by a capsid, and one unique structure of herpes virus is a tegument. It is a space between envelope and genome of the virus. They have different symmetry, different appearance, and double-stranded DNA is toroid, and that empty area between two structures of virus is known as a tegument. So you can see structure of the virus here. It consists of 162 capsomeres, and almost every herpes virus has similar structure, a similar arrangement, and they're classified into three subfamilies: alpha, beta, gamma. It is due to different tropism of tissues. Alpha subfamily affecting neurons and establish latency in neural tissue. Beta subfamily have affinity to different glands, means that lymph nodes and lymphoid tissue, kidneys, and gamma subfamily is identified only in lymphoid tissue. So every subfamily is subdivided further into genuses, and as you can see on those pictures, we have simplex genus, varicella, cytomegalo, roseola, lympho, crypto, and radino genuses. And we have species. Official name of species is just a number. Every species is named as herpes virus 1, herpes virus 2, and etc. But any virus have common name which is used in medical and even in common language, and mainly it is due to disease which is caused by that virus. So we have herpes labialis, genital herpes, and some Epstein-Barr virus, and only actually 6 and 7 viruses. They are not linked to any unique disease, and they have only numbered names. So the most frequent disease, it is infection caused by herpes simplex virus 1. Usually it is known as herpes labialis because the main clinical presentation is usually observed on lips, mouth, oral cavity, and surrounding tissues. It can be as well in chin or in nose, but typical location is lips. And again, due to some ways of sexual contacts, rarely, but that virus can be identified in genital area and can be transmitted not only oral to oral contact, but oral to genital contact. Incubation period usually not more than 3 weeks in the case of first episode, and virus will enter human body through mucus or epithelium of mouth, nose, or surrounding area. And before any symptom will appear, usually people feeling some itching or tingling sensations in the area of future rashes or blisters. And in the same area where people feeling those sensations, some elements, as you can see on the picture, will appear. They resemble vesicles, but every vesicle is broken into multiple cavities. We call it blister. So in common names, it is called cold blisters or fever blisters, because usually first episode is combined with common fever, not very high, but still. So blisters are filled in with liquid, which is transparent, and usually area around those blisters is very sensitive to any touching or temperature. And in 1 to 2 weeks, those blisters will start to shake, and they will initially covered with some frosty crust of yellowish color. Then that crust will fall down, and ulcers will be naked, and those ulcers are extremely painful. Any contact, any touching is painful, and of course it will be difficult to drink, to eat, to talk, and people usually will have loss of appetite, and common symptoms of viral infection are observed, such as muscle pains, joint pains, malaise, and other. But those common symptoms are observed only during first infection, first episode, when virus have only first contact with the immunity of the subject. So after acute episode, those lesions will be healed without any scars, without depigmentations, and virus will go by the way of the nerve, which is responsible for innervation of current area, and establish lifelong latency in ganglia. So recurrence is usually observed during some immunosuppression period, when people have common cold, concomitant disease, or some neural stress, and virus will cause recurrence of herpes infection. Usually elements are observed in the same absolutely area of the skin, but they will be less prevalent, and the same usually people will feel some burning or itching sensation in the place of future infection in 1 day before the episode. So recurrent episodes usually much shorter, only one or few elements will appear, and people again will recover faster, and no scars, nothing will remain. So we have description of kind of spontaneous convalescence, but again, convalescence means that current episode of skin infection will be gone, but virus will remain in neurons for the rest of the days of the subject. Complete cure, which is not possible. So usually complications are rare observed, but it is possible to have some serious damages of neural cells, as encephalitis, or damage of eyes, which will lead to keratitis. And the most dangerous infections caused by any type of herpes virus are observed in neonatal kids or in pregnant women, where newborn kids can be damaged, and actually even herpes simplex can lead to serious neurological disabilities or even lethal outcomes in newborn kids. And in that case, treatment, of course, is preferred. Usually during simple episodes, we can use some topical creams of acyclovir or some anti-herpes drugs, but they will only release symptoms. Of course, in the case of neonatal herpes or in pregnancy, those drugs can be and should be given systemically to prevent damage of fetus, to control virus, and not to allow it to damage fetus or a newborn kid. So, as we said, rarely, but it is possible to have lesions caused by herpes simplex first virus in genital area, and it will be a little more difficult to differentiate first and second type of herpes infection, because actually herpes simplex virus 2 causing absolutely similar infection, but in genital area. And as well, infection is transmitted only from infected human, but in that case, it is sexual contact. Incubation period is shorter, about 12 days, and virus can enter usually through epithelium or mucus of genitals, genital organs, or genital area. But in the case of atypical relationship, sexual relationship, sexual contacts. It is possible to have herpes virus in rectal area, in rectum or anal area, or even in mouth, which in that case will resembles first type of herpes virus. Actually, again, differential diagnosis is not very important because therapy and management options are the same for both viruses. And herpes simplex virus 2 usually occurs asymptomatically or very weak symptoms. And if symptoms will appear, they resemble again classic herpetical infection, blisters, vesicles filled in with transparent liquid, which will be painful. They will break and open ulcers, and for about 2 weeks. In the case of second type of herpes virus, it can last longer, up to a month. Those ulcers will heal without any consequences. And the same manner, first episode of infection always occurs as systemic infection with high fever, muscle pains, joint pains. You can observe regional lymphadenopathy, but further recurrences will be limited to only one local lesion. And the same way people usually describe their sensations like a shooting pain or tingling pain in the area of future episode of recurrence. And usually, in the case of herpes simplex virus 2, recurrences are much rarer than in first virus. Usually, only few episodes during the life can be noticed by infected people. In the case of second type of herpes virus, actually as any other sexually transmitted disease, concomitant infection, especially with HIV, is a risk factor of worse outcome of infections. And if someone is infected with herpes simplex virus 2, then risk to become infected with HIV infection is increased by threefold. So we don't have again any specific measures of prevention such as vaccines, but common measures to prevent, to avoid sexually transmitted disease are applied for herpes infection as well. Of course, if you see that your potential partner have some rashes, ulcerations, or blisters, it's better to avoid any contact. Sexual contact should be protected if person is not very good known for you. And of course, common hygiene measures as personal clothes, personal toothbrushes, personal towels, and other is a good risk to prevent any infection transmitted by sexual or oral-to-oral contacts. So in the case of herpes virus 2, we have few vaccines which are in study of research and development, and we have no enough data to tell anything about those vaccines, but they are registered and approved for clinical studies, for clinical research, and maybe soon we will have some option to prevent herpes simplex infection by vaccination, but nowadays it is only non-specific prophylaxis. So a few photos of those lesions. They are very similar to herpes labialis, the same blisters filled in with transparent liquid. They will break and open ulcers. Ulcers can be surrounded by a radius zone of inflammation, and again, they will heal without any consequences. So according to data, as I remember, it is WHO data. In 2012, it was a study to check how many people are naturally or not naturally, how many people are infected, have chronic infection with herpes simplex virus, and it was identified that actually almost 70 people under 50 years of age have infection of herpes simplex virus 1. Of course, main number of them asymptomatic and they're not suffering from any disorders, but that virus is present in our tissues and our bodies. We living with it, and we can do nothing here. So herpes simplex virus 2 is much less prevalent. About 11 people of sexually active age are infected with that virus, and again, as we said, a lot of and main number of infections caused by herpes simplex virus remains asymptomatic. So if you talk about contagious potential of people, it is confirmed for sure that blister stage is the most contagious for any type of herpes infection. But even people who are asymptomatic, who have only latency of herpes virus in ganglions, they still remain infectious, but of course rate is very low. And usually that infectious rate again increasing during episodes of immunosuppressions. So it's not a point to be afraid of everyone, but still you should remember that if someone was ill someday with herpes simplex virus infection, they can remain contagious for lifelong period, and it's better to take some common precautions as at least hygienic measures and protected sexual contacts.